The following portion of Daytime is sponsored by Orthopedic Medical Group of Tampa Bay.
A rotator cuff tear is a common cause of pain and disability among adults, making daily activities like combing your hair or getting dressed difficult and painful. Here to tell us about a way to treat this shoulder pain are doctors Christopher Donaldson and Bryan Butler with Orthopedic Medical Group of Tampa Bay. Gentlemen, welcome. Thanks for being here.
Thank you for having us.
Yes, thank you, Maggie.
It's our pleasure. Let's start with the signs and symptoms of rotator cuff tears and shoulder arthritis. What are they? What should we look out for?
Well, for rotator cuff tears, the biggest sign and symptom is pain. I mean, most patients come in complaining of pain. It's usually down the outside of their arm. It's called referred pain. It goes down from anywhere from here down to the mid-arm. But they can also present with stiffness, difficulty getting their arms up over their head, and weakness. So weakness is a big sign of rotator cuff tears.
What about shoulder arthritis?
Similar, pain is a significant component of that. Stiffness will also develop in folks who have arthritis because of the bone spur development. Now, folks who have rotator cuff related arthritis, we call that rotator cuff tear arthropathy, fancy words, but basically essentially arthritis related to rotator cuff tearing. They can have weakness there as well. Night pain is also a significant symptom that we see as well.
Can you treat both or either of these non-operatively?
Yes, definitely. I mean, actually, probably 80 to 90% of our patients that we see in our clinic actually never go to surgery. So our goal is always try to get them functionally improved and their pain controlled without surgery. And physical therapy is one of the mainstays. And so we do a lot of referrals out to physical therapy, anti-inflammatories by mouth. There's also gels. And then one of the other things we use is cortisone shots, so steroid injections.
Yeah.
So let's say that surgery is necessary. Dr. Butler, how would you treat a rotator cuff tear surgically?
Well, the key now is it's minimally invasive, which means we go in with little cameras and little instruments called arthroscopy. And so what we're essentially going to go in and do is first clean out all the inflammation, and that's called a debridement, and that's done with a little shaver and an ablator. But the mainstay of the treatment is to fix the rotator cuff tear. And so we use these instruments. This is an awl. This will punch a hole into the bone where the tendon is supposed to attach. And then we take this thing called a suture anchor, which is usually synthetic, all right? And there's different types, different brands, but essentially the anchor, which is this little piece here, goes into the bone. It has an eyelet. The sutures go in and out through that eyelet. And so now this is in the bone, and then we pass the sutures through the tendon and tie it down. And this is an example of a model. You can see if this was the tendon and this is the bone, the sutures are crisscrossing and tying the tendon down.
Nice stitching.
Yeah, thank you.
What about if you're treating the arthritis surgically? How would that work?
Yeah, so a little different from the arthroscopic approach that we use to treat rotator cuff. We do minimally invasive techniques for arthroplasty or replacement surgery as well. So we, both Bryan and myself, like to preoperatively plan. We use some very specific planning guides that are done by computer generation that help us guide us in the operating room, so increasing our accuracy, decreasing our complications, and improving on patient success. But those are typically done through open procedures. We like to do them outpatient, many times in a surgery center. We can utilize things like shoulder replacement for degenerative arthritis of the shoulder, so normal wear and tear arthritis of the shoulder. This would be an example of anatomic replacement, so meaning replacing the arthritic ball with a metal ball, replacing the arthritic socket with a plastic socket. Different to that, or in contrast to that, would be somebody who has rotator cuff tearing. And so arthritis related to that can be replaced with this reverse ball and socket replacement. So different from this anatomic model would be replacing the ball now on the socket side and then creating a socket on this side where the ball used to be, so that we can recreate tension in the muscle to generate the power and function that patients need.
Amazing what you can do, Dr. Donaldson, Dr. Butler. Thank you both so much.
Right,
Thank you so much.
And if you'd like more information on Orthopedic Medical Group of Tampa Bay, you can visit omgtb.com or follow them on social media at OMG Tampa Bay. Daytime will be right back.
The preceding portion of Daytime was sponsored by Orthopedic Medical Group of Tampa Bay.